So forget about the hola and let's get straight to the professional stuff. It's not very common in the healthcare setting. Now keep in mind, good night is also buenas noches. Now when this happens, you'll often hear natives say, es un placer atenderle. ¿Cómo se encuentra? It's both direct and professional. I wouldn't change much there. Okay, so it seems like when you greet and introduce yourself to a patient, everyone uses hola followed by soy. Now let me ask you this. How else can you introduce yourself in Spanish? You got nothing? Well, don't worry. I'll teach you how to sound like Grey's Anatomy in Spanish.
Revisar el intestino quiere decir que debemos sacar los 11 metros de intestino de la cavidad corporal y buscar manualmente los globos para extirparlos.
So, forget about the hola and let's get straight to the professional stuff. Now, instead of just saying hola like you're on vacation, you have to remember that you're a healthcare professional and you want to show it, right? So in the healthcare setting, you introduce yourself like this. Now you may be used to saying Buenos días, me llamo, and then your name. Now, although this is grammatically correct, it's not very common in the healthcare setting. So instead of me llamo, switch it to mi nombre es. It's more natural and respectful for natives. Now let me give you some examples. Now when introducing yourself, you can use hola, buenos días, buenas tardes, buenas noches. Mi nombre es, your name, y soy su enfermera if you're a female nurse, enfermero if you're a male nurse, doctor or médico if you're a male doctor, or doctora if you're a female doctor. Now, as you may already know, we use buenos días in the morning, we use buenas tardes for afternoon, and we use buenas noches for evening. Now keep in mind, good night is also buenas noches. Now, you're still starting with hola, but your introduction is a lot more elaborate. Okay? Now you wait. After their answer, which is usually their name followed by mucho gusto or un placer, I would suggest an addition after their answer. You can say encantado if you're a male, or you can say encantada if you're female. It means delighted or pleased to meet you. Now, why the difference between encantado and encantada? It's because Spanish adjectives change based on the person doing the speaking. So let me explain this to you. So when you say encantado or encantada, you're showing your delight in a way that matches your gender, if that makes any sense. Now, this introduction that I just showed you is going to be your bread and butter if you want to sound respectful and professional in the healthcare setting when you're introducing yourself. Now, if you don't like that one, let's move on and we can make it a little bit more polished. Now, in Spanish, as in any other language, addressing your patients properly adds another layer of respect per se. Now, when this happens, you'll often hear natives say señora, señorita, or joven, which are all used before last names. But here's the thing, in some cultures, especially in Latin America, you'll hear don and Doña with their first name. To give an example, Don Jose or Doña María.
Buenos días, don Flavio.
Buenos días.
Doña de la Vega, still as beautiful as ever.
Don Rafael. What an honor.
Now this shows a high level of respect. And just to give you some background as to what this means, the titles Don and Doña originate from the Latin words dominus for men and domina for women, which mean lord and lady, often given to people of noble or high class in medieval Spain. Now over time, their use traveled through Spanish-speaking countries, where they are still used to this day. So to your next patient, if you want, you can say, Don Jose, ¿cómo le puedo ayudar? And that's very respectful. Now, I already told you, but after your intro, you want to ask the patient, how can I assist you, right? So most people say, ¿cómo le puedo ayudar? It's both direct and professional. I wouldn't change much there. When saying goodbye, you may want to use something more professional other than just saying adios. You can use it with your close friends or once you've built a rapport with the patient, but I wouldn't use it at the beginning because you don't know the person. Instead of just saying adios, which can sound sometimes a little abrupt in the clinical setting, nos vemos pronto, enseguida vuelvo, or if you're gonna see them in clinic, nos vemos en clínica. These three are ubiquitous in Latin America in the clinical setting. Use them. Now, many times, both doctors and nurses always ask me, why is it that when I speak Spanish to my patients, they don't understand me? This happens all the time, and even when good pronunciation technique is being used. So it's not on you. This is because the tuning out effect plays out. Now, studies have shown that when providers switch to Spanish, patients may still struggle to engage if the change happens abruptly. So let me give you an example. Let's say you're speaking in English and the interpreter is helping you, and you switch to Spanish really quick on the patient. Patients may feel confused or disconnected when doctors or nurses make that change really fast, especially if they have been relying on the interpreter to know what's going on. Now, if you've been speaking to a patient through an interpreter and now you want to speak to them in Spanish yourself, don't just jump into it. Let them know. Give them a heads up to avoid confusion. You can say, voy a intentar hablarle en español. Or even simpler, voy a hablar en español. I am going to speak in Spanish. Now, to those of you that want to sound a little bit more fluent and professional when introducing yourselves, you can use this one. You can say, Buenos días, soy el doctor or la doctora blank. Su médico del día de hoy. Es un placer atenderle. ¿Cómo se encuentra? Now, this is polished and it adds elegance. If you're not there yet, don't worry about it. We'll get you there.
So elegant.
So let's recap. You learn how to introduce yourself, ask how you can help, and say goodbye professionally, plus some cultural tips on how to sound more like a local. Now, all these will help you build rapport quickly. Make sure to practice these phrases and you'll be giving your patients a better experience in no time. And remember, it's all about confidence. Whether you're a beginner or advanced speaker, the more you practice, the better you'll get. I hope this was very helpful. Thanks for watching. Nos vemos pronto.